Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. On this episode of the program, we'll draw our focus from the 2023 World Food Day commemoration, which centers its theme on water is life, water is food, leave no one behind. This theme highlights the essential role that water plays in our lives and in our food systems, with food systems activities accounting for about 72% of global freshwater withdrawals, which is required for crop cultivation, animal husbandry, and food production. It has become extremely important to manage and reduce water use by agriculture, food, and other land users. There is need for increased public awareness on the necessity for water management in a world where water availability is being threatened by urbanization, poor management, pollution, and climate change. Now let's take a look at a report from Lagos State to mark World Food Day and the food situation in the country at the moment.
Among man's basic survival needs, food is the most important. This underscores the continuous patronage of food items despite soaring prices. Some customers and traders at the market in Ogba lamented the high cost of food items and missed static incomes. Wahid Arinjai, a butcher, lamented that compared to Salah period, prices of cows have increased, adding that he cannot tell the actual reason for the increase in prices. Lijoka Olajumoke, we came to the market to get tomatoes, said despite the preponderance of food items in the market, many cannot buy because they are expensive.
Actually, there are food in the market, but they are kind of expensive. I won't lie to you. Imagine 300 naira tomato. Like when the Hausa man gave me, I was like, imagine 300 naira. I can't just buy this thing, but I don't have choice. We have to eat. At least we will take something, so we don't have choice. We just try and do something about it.
Another customer simply identified, as Kemi said, her salary only covers her transportation to and from work, adding that very little remains for food, which is gradually getting out of our reach.
This inflation of a thing, I don't know. They should just try and look into it because it's really becoming alarming. The salary take home is actually small, but the prices of things in the market is not even up to, the salary is not even up to buy things again.
They urged the government to find a lasting solution to the food crisis that is befalling the country.
Though there are no signs that the day is being celebrated in the state, residents expected that the issues bordering on food scarcity is part of the primary responsibilities of government. These nutritionists share ideas on the need for balanced diet and food affordability in the state.
Food is actually what sustains the human body and keeps the human body functioning properly. So in terms of importance of food, I think food plays a major role in making sure that the human stays healthy, stays fresh, stays energetic, and is able to perform the duties or functions properly as it should. It's a governmental level to individual. People have talked about how the case of food affordability and availability has been a problem over the years.
Other residents said they cannot afford decent meal because of the high cost.
I wouldn't say we are facing a food crisis, because when prices are out of the reach of the common people, I think that is a crisis. The federal government and the state government, they're not investing in agriculture. That's the truth. That's the truth.
No food, we no see food chop, no food. Everything costly in the market. We don't see fresh tomatoes, no onions. Is it rice? Rice, a cup now is 250. Somebody who have like me, I have 4 children. I'm unable to afford common half pint of rice for my children.
Garri is too costly, rice, beans. Even sometimes my children like potato and beans. But the potato and beans now is very costly. Hardly you get it.
Like everything is just going wrong. It's going wrong. Like no food. Like it's even hard for my parents to provide for me. Like sometimes you just eat. It's even hard to eat 2 times a day.
They call on government at all levels to find lasting solution to the food insecurity.
My call is very simple. The government, whether federal or state, should invest more in agriculture. What people are doing here is what they call subsistence farming.
My message to the entire world, and particularly in Nigeria, it's simple: make food available to the population. People should not live and suffer from starvation and hunger. Food should be available. People should be able to eat.
The 2023 World Food Day, with the theme Critical Role of Water, is geared towards ensuring that everyone gets access to clean water, as it is the major source through which food is made available.
Another key water-food system linkage is water supply for water, sanitation, and hygiene, which is important for human health and well-being and can support nutrition outcomes, particularly if combined with other interventions. So, while we drive effective water management for food production, there is a need to improve access to clean water to underserved populations. We must first recognize its availability in communities, either in urban centers or rural centers. In the Federal Capital Territory alone, there are still a number of challenges associated with the provision of sufficient, sustainable, and equitable water supply or sources for residents. Now let's take a look at this report.
The Federal Capital Territory Water Board is bent on disconnecting over 30,000 households from water supply over the non-payment of utility bills, but experts are quick to advise the board to develop a mechanism to stop water theft.
So the question we need to ask ourselves is that, for example, in my place, I have a meter. So if I'm metered, before I can enjoy water supply from water board, I see no reason why we should be talking about 30, 50 or 40% of people are not paying. So what that means is a very big indictment on the part of water board. So what that means is that they are not up and doing in terms of what they are doing. Yes, I know community societies are prone to water theft, just like we are witnessing the power theft too. So, but again, that shouldn't be an excuse. They know these people and they should be able to go after them, and they should be able to put a mechanism in place that can actually stop, water theft.
Meanwhile, the FCT has one of the largest density of boreholes in the country, which means the government has to take strategic actions towards limiting this drilling process, as it has done more harm than good.
We all know the process of, digging borehole. It involves a lot of pressure. And the more we begin to put pressure into the underground water, the more we are writing letters to things like earth tremor and possibly earthquake as well. Because the more boreholes we have, the more we are trying to activate the process of earthquake.
He used the opportunity to highlight pathways for the future.
Yes, we can see that government are laying pipes, what they call integrated water supply in the city. That is what is expected of government. But they need to intensify effort to ensure that they quickly expedite action on that. We can't just do without that. And the concentration shouldn't be on the city center alone. Just like I used to discuss among my colleagues, if possible, we need to declare a state of emergency on water sector in Nigeria.
With more than 1 billion people in the world having limited access to safe drinking water, there is need for the situation to be addressed, the FCT inclusive.
It has now become pertinent to explore and expand on the essence of consuming clean and potable water in order to maintain health and wellness, as well as we all know, the role that water plays in our bodies and the resultant consequences of consuming contaminated water. Let's join an expert to further shed light on water sources, contamination, risks of waterborne diseases and their impact on public health, the environmental consequences of water contamination, such as pollution of rivers and ecosystems, as well as long-term effects on agriculture and food production when water sources become polluted.
Water is important, and embellish that point, 60% of the body is made up of water. If you were 100 kg, we can see tably that 60 kg of you is basically water. The liver, the kidneys, and even blood are made up of 83 or to 85% of water. The brain is made up of 75% of water. And the bone that are hard are made up of as much as 22%. So if anybody isn't about the importance of water life, I think that doubt is buried. And to embellish the point even more clearly, if you go off water for 3 to 5 days, you will increase your chance of dying, because after 3 days of not ingesting water, what happens is that your brain begins to lose volume. You can have seizures, and you can go into a the kidneys can shut down and toxins begin to accumulate. Liver begins to fail, and you go into what we call the multi-organ dysfunction syndrome, and that definitely leads to death. So it's very clear we are water, and water is us, that we need water to survive. We have multiple days of waters. Fresh water is critical because it's important for domestic use, but we do have water from other sources that are also used for industrial use. They are critical and they are important. We need to have access to what we potable water, which is all the quality of what used for domestic use. So it should look clear, it should be nice, it should be free of toxic, it should be free of organisms that are contaminants and pollutants and maintain the life. So water is a very critical component of survival to a large extent, and we know that water, safe water, is responsible for over 1 million deaths yearly, and is also plays a car role in undermining the quality of life. So it's responsible for much as 20 million of adjusted life years per annum. So they are all critical components of the challenge we experience if we are safe water. Beyond that, we know that contamination of that is responsible for multiple implications, healthcare and at personal and at the public health level. For example, things like agricultural contaminants are important. Things like in our context in Nigeria, agricultural contaminants, chemical contamination from oil spill, some to a very little extent, like condition. But we know, for example, in the water bodies that surround where people reside, one of the contaminating factors for this water renders them unsafe and endangers health. Things like dumping of waste, indiscriminate dumping on waste into these water bodies, purification and all of that. These contaminated water bodies and endanger people who are using these water bodies for stick use. If you go to organized societies or communities in certain parts of the world, you can have better organized structure framework for the disposal of wastewater. So wastewater is very important. We have the facilities. Wastewater is best recycled and rendered safe for the environment. In Abuja, for example, where you have the waste water plant in Wupa, called the wastewater treatment plant. What it does is collects water from wastewater in form of sewage and water that run over water from rain sources, even industrial water waste. Collects it, and it has the capacity to treat wastewater as much as 1 million liters of water capacity. But it has also, of course, opportunities to increase that capacity because that wastewater plant was constructed when the SE, for example, had lower population than it is. But again, in some of the other states of federation, I don't think we have this capacity to do wastewater treatment, except maybe for Lagos, Abuja, and one other states. We do not have wastewater treatment capacity, and that means that wastewater of wastewater and sewage indiscriminately dumped in the community. They find themselves eating water bodies where kids and kindred to access water for domestic or other uses, agricultural uses, and are such exposed to chemicals. They are exposed to dangerous microorganisms that have not been degraded. So that is a significant and it endangers life. Natural waste like pesticides, chemicals, and waste from husbandry are also a critical component of water pollution that reduces the quality of water, to a large extent increases the health and toxic health risks. Those who are exposed or use that water are at risk, and again has a significant public health implication to an extent. One of the commonest one of the important cause gastroenteritis, that is what we call vomiting, the abdominal problems, are usually following contamination of water. And we have in communities where public works is not strong in terms of water supply through works, where people depend on their own sources to source for domestic water life, there is a high risk. So it's not about most cities in Nigeria where we do not have properly structured public water supply that passes through the collection phase, the decontamination and distribution phase, lies in a safe manner. People are exposed to bodies that have been contaminated through open defecation, dump waste, and all of that. So you have patients, massive cases of infections, gastrointestinal infections. The common obviously is called the Salmonella typhi, which is when contamination of water with feces, because like we say, who has typhoid confirmed to have typhoid, eaten or drank food or drank water that is contaminated with feces or was contaminated with a certain point. So it's very critical. And then when you have a situation where you do not have a structured disposal of fecal matter, and then the sewage itself in the community contribute contamination of agricultural use, fruits, vegetables, and is properly processed, washed, cleaned, and stored and distributed properly, it can lead to public health implications and contaminants. Where you have indiscriminate dumping of waste from industries, for example, have not been treated and before being disposed into the community. What happens is that you have high levels of the chemicals to a large extent at the head. So we need to have things like you need to have structures in place to monitor, for example, the lead content, water, and other chemicals that are important. If they are safe level, there is need there's need to take up the necessary actions to meet this. So you need to nip this at the bud so that chemicals that are bought from industries are properly degraded before these waste are disposed or discharged to the water for final process by the natural cycle. Well, you can't prepare any kind of food without most times. To cook a lovely soup, you need water. To marry, you need water. To boil cereals, you need that to a large extent. And sometimes you carry with just water. The that is very common in Nigeria. So it's important that safe water is encouraged. People are educated on how to access water and to produce. So even if you were getting water sources that you cannot guarantee, microorganisms like general water bodies, you need to know, and you need to boil and filter water before consumption. In terms of other domestic use, definitely is important to maintain the highest of hygiene. And for hygiene water, if you are not taking your bath for 7 days, it can amount to expose yourself to skin disease and KBs, kinds of dermatitis, dermatophytes, and all of that. So skin infection, personal hygiene is important. Let's not forget that even to maintain hygiene, which is a critical component of health interventions, even like we now see in the area case may be, hand hygiene is very, very important. You cannot maintain hygiene where you do not have water. So water is critical for public health. And even if you look at the WASH principle in public health intervention, water sanitation, you can see that the word there is that really puts you that at the top most public health intervention is water. In perpetrating water wastage, part of the problem has to do with you need to be able to educate people that waste of water is undermines the access water by members of the population. So, like, for example, underground water has been significantly depleted due to indiscriminate drilling, borehole drillings, and all of. With time, we may have some challenges accessing the amount of in terms of underground water. It's important that people are educated that water conservation is an important component of comprehensive public water management. So in certain communities like with South Africa, in the Cape Town region, there was a period in time where due to challenges with water, they came up with policy about turning the amount of water that you use. Some people build very elaborate and fanciful houses that may increase their water consumption. So in architecturally, in architecture, in construction, and some of the science in constructing this infrastructure is in a manner that ensures that water conservation is taken into consideration. With respect to even the water system, the technology has allowed us to develop new water system equipment that allow for minimal usage of water in disposing feces, not much water as usually. That's not requiring as much water that was in the past or flush water system. So yes, indeed, it's time that we use technology and science to educate our people and develop very cost-efficient ways deploying water, and knowing that water is a resource and that it's possible. We need to start by assessing what is the water need of the. Once you are able to determine that, of the communities and predict or forecast the need going forward in terms of making projections. Then you can now, based on the need, the projected, you can come up with an intervention. It's usually better to have a common water source, usually from a water, a river or a lake, which is taking treatment plant, ensure that it's properly decontaminated, microorganisms degraded, and chemicals and nutrients are then necessary before being discharged through a network of reticulation, network of pipes to homes. That way you can control the quality of that is available to the public. Then, because you are able to control the quality of water available to the public, you can, to a large extent, strike a definite health condition, diseases that are borne by contaminated water. So by doing that, you completely eliminate things like typhoid, which will be transmitted contaminated water, things like other waterborne disease reporters that can be transmitted by mainly water that are sourced from water bodies and are not properly decontaminated or prepared before consumption. So water works is a critical public health intervention infrastructure, and we storage it. You can do public water work, communities to communities, do small public water works. We are talking about refineries in the gas industry. We should also be talking about small portable water works. Use sustainable resources like solar power bodies, and ensure that our people in our communities are prepared with excellent sources. These, apart from the health angle, would also use the indiscriminate drilling and sinking of boreholes, which also have implications, as you already noted. My last word would be that what component. These are made up of 60% of water, 70%, leave 83%. So it's critical and important that we understand that water is life, and we should make effort to come up with comprehensive solution to our challenges when it comes to water.
Water scarcity poses a significant threat to the sustainability of the food system, impacting production, processing, distribution, and overall food security. Hence, innovative water management practices have shown promising results in enhancing food system sustainability, emphasizing the importance of implementing efficient and sustainable water use strategies for the benefit of our health and well-being. With that, we've come to the end of this episode of the program. For comments, contributions, and suggestions, do well to subscribe and follow us across all of our social media platforms. Join us again on another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for your time.